I know there was a big push, and I don't know if that's still the case, where I think a lot of medical professionals, right, they could get the school loans forgiven if they spend some time in rural communities. Have you seen that program be successful in bringing in staffing and individuals who are excited about, or at least wanting to help the community and spending time there? Are we seeing some great results from that program?
That has been a huge help. Sometimes it's not long term, it depends on the individual. Yeah, there's a number of those programs out there, usually sponsored by governments or in our area. We have several Indian nations, so Choctaw Nation of Oklahoma, Cherokee, Chickasaw, and the Public Health Service Corps runs a similar program. Well, forgiveness of tuition and student debt to serve in those facilities. So bringing those folks in, it does help. Honestly, we get so involved in it. I try and help recruit when I run into medical students who have a particular interest. If there's someone going into the profession who prefers to be in a rural area, we love to recruit them. I think they have so many opportunities out there because the recruitment, community support, additional supports they would receive moving out to a rural area would be pretty top. There's some urban advantage we can't compete with, money and other things, maybe political connections if that's important, but that particular candidate is interested in that. There's a lot of people reaching out to them. We'd like to have them out here too.
I love it. I love it. But, I would say this, let's look at the glass as half full as well. Are there opportunities in rural care, right? One of the things, the government partnership, right, in rural communities, right, the big HRSA grants. As we talked about, the pandemic just happened. There was tons of money that was pumped out to rural communities to help with telehealth resources, right? And things of that nature from the FDA and other entities with government. So it seems like rural communities are kind of like the crucible where the government is allowed to put money into and test different ways to treat patients and populations. What are your thoughts about that partnership with the government? Are you seeing positive feedback from that and the innovations they invest in? Is that something that become eventually sustainable programs?
The fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about the healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.